Hey guys, this video is going to be on diagnostic ultrasound and actually seeing the ulnar nerve as it just before it passes into the elbow and how it moves in relationship to the neck. Now, the reason why I'm doing this video is because I just went to a course recently on Michael Shatlock for neurodynamics. It was an amazing one, and he had some great videos on here that he took. So I'm going to take some of my own because I think this is really useful for people to see. Now, let me just make some reference points on this because I think it's going to be very hard for people to really tell what's going on unless they can kind of see what I'm looking at and what things are on the screen. And then we're going to go into how the nerve moves with head movement and arm movement, or a finger movement without even moving the elbow. So this, first off, just notice, I know this is a glaring thing, this is just the bone, don't worry about it. This up here, this white area, and it leads into this area right here of, it looks like a starry sky. It's actually, that's the nerve, that's the ulnar nerve, as it passes just proximal to the elbow and before it goes into the cubital tunnel. I could do a video into the cubital tunnel as well. I might at some point, but for the most part, as I was playing through this, I found that this one was a really good picture of what we want to see, or what I want to demonstrate to you guys. And the reason why these are going to be nice is because if we have people with elbow pain or even like radiculopathies and so on, we have to question the possibility that this is a peripheral nerve entrapment. And when testing, if the head actually changes the person's symptoms, simply tilting the head away or towards, then I think we have to consider this possibility. Now, again, this is the nerve, and as I start to turn the probe 90 degrees, it's going to start to elongate. So just keep an eye on it there. Actually, let me get some gel first. So we're going to keep an eye on it there, and I'll tell you exactly what I'm going to do when I'm going to do it, so you can see how the nerve moves in relationship. Okay, so you see the middle of the screen there, we're going to keep an eye on it. We're going to elongate it. That's how we know we still have the same structure. And boom. Okay, right there. So it's going to be that area right up there when I start to move back. So it kind of looks like a hollow tube on long axis view. That's how we know we got it. And it shouldn't be as solid as a tendon. Tendons will be a little bit more like freeway-like or white. So here's what I'm going to do. Let me get a good spot on this right there. That looks good. So all I'm going to do right now, and this is my left arm, I'm actually just going to tilt my head to the right. And now to the left. And now to the right. Okay. Moving the left side of the screen here, this is actually proximal. This is more up my arm and towards my head. The other side is towards the hand. So what you're going to see, let me position my shoulder here in a nice spot. There's a nerve again, cross-sectional, let's elongate it. Boom, right there. Okay, so let me max the tension out on the nerve before we actually move it. Oh, this is going to be a good one. Okay, so notice right up there, I'm going to tilt my head to the right. See how the nerve pulls towards my head, and now I'm going to go to the left, and it's going to pull towards my fingers, and I'm actually going to move my fingers now. All I'm doing right now is my head is tilt is left, and my fingers are moving into max extension, and now I'm making a ball in the fist. Now I'm going to tilt my head to the right, which is then pulling it to the left. I'm going to tilt my head to the left, which is allowing it to go distal. Now I'm going to pull the fingers into extension, and it's going to go more distal. So just notice how this nerve moves back and forth, all right? I'm not moving the elbow whatsoever. So I think this is an important part for patients to realize that when you have a condition of a nerve, you have an entire path that it actually should slide. I'm going to move a little bit more proximal here. Look how much this thing slides just with head movement. It's crazy, right? So when you have conditions into the brachium, check these things out. Don't ignore them. Don't just work on the neck, work on the fingers, work on slide. And there's a time and place for all this type of stuff. And if you want to learn more about this, go to that clinical neurodynamics course. It's pretty amazing. And again, this is at the elbow. Here is more actually at the elbow. Here's the cubital tunnel. I just went superior. Now I'm about 1 inch above the elbow. If you guys have more questions on this, feel free to reach out to me. Also, too, if you want to see a certain spot, just hit me up. There's a video correlated off to the right side of the screen, and also to a section that you might be interested to in the Neurodynamics podcast, which I plan on having with him. Talk to you guys tomorrow.